Hi, my name's Webster. I'm a Principal Lecturer at Nottingham Trent University.
My name is Rachel Pogson and I am a lecturer in paramedic science at Keele University. So pharmacology underpins so many aspects of patient care and clinical care. So it's imperative and really important that clinicians have that strong underpinning knowledge of pharmacology.
So I think pharmacology is typically a subject that people struggle with. We know it's really important. It's in the HCPC guidelines, it's in the College of Paramedics curriculum guidelines.
Paramedics often have lots of resources that come from other professions, and although they can be really useful, they often don't fully translate into paramedic practice. So it's so important to have resources that are tailored specifically to paramedics, and I think really helpful that it's been written by paramedics as it gives credibility and that realistic application of quite complex subjects.
So paramedics come across drugs in almost every interaction with patients, so whether this is as a clinician administering the drug, whether it is patients that are on lots of medication and understanding how that influences their clinical decision making, or whether a clinician is moving into prescribing. Most patients' interaction involves understanding drugs and medicines in some form.
Essential Pharmacology in Paramedic Practice is split into two key parts. The first covers the core pharmacological principles and includes other things such as legislation, adverse drug reactions. The second is centred around the JARC medicines. It covers all the key medicines that are given in daily paramedic practice, and it includes individual pharmacokinetics and pharmacodynamics of each, including clinical use and case studies that are realistic and illustrate how these medicines can be used and engaged with in practice.
So the inspiration from the book came from both working with clinicians out in practice and with students in education, where I found that a lot of people really struggled with the concepts of pharmacology and applying it to real life practice, things that they were seeing out on the road, out in practice, and bridging that gap between the theory and the practice that they see.
So although the book is called Essential Pharmacology in Paramedic Practice, it is aimed at paramedics, but it's also aimed at student paramedics, emergency medical technicians, clinicians that work within ambulance services and pre-hospital environments. It's aimed at those who might have a good level of underpinning knowledge but just want to learn some more. It's also aimed at those who struggle with these concepts. It's certainly aimed at student paramedics that will be studying this subject within their programmes. It's also aimed at paramedics who are looking for CPD and who want to know more in this area, maybe as well as paramedics who are undertaking prescribing qualifications and just want some more foundational knowledge. And it's a resource that people can pick up and take bits that they are interested in. It doesn't need to be per se read from cover to cover, although it can be. And so we try to gear it towards a really wide range of people, but with that foundation in pre-hospital paramedic practice.
The book helps the reader to understand pharmacology by providing really clear explanations of the scientific content, but relating that throughout the book to clinical case studies that paramedics and student paramedics will see out in practice. The three words I'd use to describe this book are informative, accessible, and of course, essential.